It is the worst week yet in terms of COVID-19 related deaths. Already 14 have been recorded in 4 days, with 10 of them having succumbed lately. Of the 10, 7 are reported to have had pre-existing conditions, 4 being diabetic, 1 had high blood pressure, another one was nursing acute myeloid leukemia or blood cancer, while 1 was living with HIV.
And I think this is a second or third HIV COVID positive case that we are reporting. Studies from South Africa have indicated that those who are taking the ARVs appropriately are able to achieve viral suppression.
According to Ministry of Health statistics, the highest number of deaths occurred at the Kenyatta University Teaching, Referral and Research Hospital, where 6 patients succumbed. On the same day, the highest number of infections has been recorded after 6,024 samples were tested. 213 turned out positive, an infection ratio of 3.5%. On Wednesday, an infection ratio of 7.2% was reported when 184 positive cases were detected from slightly above 2,500 samples processed. Majority of the 6,000 samples were from a backlog of samples, mostly those that were pending at chemistry labs. The fear now being that from the delay, some of those that have now turned positive could have been spreading the virus without knowledge.
There is always danger that if you have a backlog like that and somebody tests positive, after you have kept a specimen for 3-4 days or 1 week, and the person is moving around, of course, there's always that risk that he or she would be able to transmit the infection to other people. But what else could we be able to do? There was nothing, because we didn't have the test kits to be able to confirm.
On monthly statistics, June remains on course as the worst COVID-19 month. So far, 2,295 cases have been detected, a daily average of 127 positive cases. While the caseload now is at 4,257, 2,681 are still nursing the virus, but it is only 463 that are admitted in hospitals. The rest could be at various isolation facilities, and since most are not exhibiting symptoms, they require no medication. But there is an unknown number of people that are yet to be traced or moved into isolation. The threat of spread of the virus still apparent at a time the ministry is fatigued with tracing of contacts that is proving difficult.
It is usually very, very difficult to be able to do contact tracing once you have established community transmission. So linking somebody with a contact becomes very difficult, and it becomes very, very expensive and tedious and tiring for the healthcare workers. So then you shift your plan from doing contact tracing to basically trying to contain the spread of the infection.
Among those admitted at various hospitals, 15 are at ICU facilities, including 5 admitted at the KU Hospital, 4 at the Aga Khan Hospital, while 3 are admitted at the Nairobi Hospital's ICU. In the latest numbers, Nairobi remains a cause for worry. 136 cases are spread across 12 of the city's constituencies. Dagoretti North and Westlands lead the pack with 36 and 25 new infections, respectively.
This requires serious soul searching by residents of these estates on what it is that they are not doing right, and that enables this virus to spread in those communities.
That the country has now reported at least 200 cases in a single day is coming to reality of an earlier prediction. The sad reality being that authorities are now admitting the difficulty in tracing the contacts of positive cases. And now, more than ever, Kenyans are being left to their own guard. Sam Gituku, TV, Nairobi.